Okay, this is Dr. Gregerson. He's going to do a little demonstration for education purposes. So tell us what you're going to do.
Well, what happens is one of the big problems that we have in patients with Sjögren syndrome is the symptoms can mimic so many other things. And what a lot of it revolves around is, let's say you have a nerve coming along and it's branching out. Then there's another nerve that comes up next to it, and it comes along, comes up to this nerve body, wherever that is, and then it goes out to the body from this nerve. Well, the important part is this right here. And if we were to enlarge that, then we would see that it's somewhat encapsulated where those two nerves meet. You could say that electricity or a charge or depolarization of the nerve comes along here, and it causes some little factories on this side to make a chemical. We'll represent that chemical as S. And this chemical comes across and interacts with some other factories over here. And these factories then make electricity or depolarization or whatever, and off that charge goes. Well, the way it sits right there, that's a one-time shot. Unless you had other factories, maybe outside here, that would take this chemical out of that gap. So that chemical is called serotonin. And so let's say it takes 100 serotonin molecules in here to make this fire off. Well, if you take 100 out each time with these factories, then you're going to have to make 100 new molecules each time. But the body's a lot more smart than that, so it might just take out 10 of them, leaving 90 of them in here. And so now all you have to make are 10 each time. That's a lot more efficient. And that allows this to recycle itself and reset itself each time after a nerve impulse comes through. Now what happens is a lot of patients with this myofascial pain, instead of having 90 of these left in there, there may be like 40 or 50 of them left in there. Well, that means that you have to make 50 or 60 serotonin molecules each time. And so that is really the problem, is a decreased amount of serotonin in this gap. Now we know that there are several factors that can help increase serotonin in that gap. And one of them is getting stage 4 sleep. Sleep is just not, you go to sleep and you wake up, or you go to sleep and then you have some dream sleep. It's not just like that. There's architecture to this. And stage 4 is this stage in which serotonin from your colon is produced and then brought up into the brain.
Did you say from your colon?
Yes, 90% comes from your gut.
Okay.
And that's why gut health is so important.
Yeah, I thought it was from the brain.
Well, it's interesting. There's a book by Dr. Stephen Gundry. He talks about the number of fibers that go from the brain down to your gut through the vagus nerve. Even though it's a very small nerve, there's 9 times more fibers in that nerve than there are in your spinal cord. And he quotes the studies in this book called The Longevity Paradox. Incredible book.
Mm-hmm, it is.
Anyway, so the problem with a lot of this myofascial pain is, how do we increase serotonin in that level, in that gap there? So the first thing is through sleep. And we want to do something that will increase stage 4. And there are some medications that can do that. Melatonin can do that. I usually like to try something called amitriptyline. It's an old antidepressant, but it makes people sleepy. And the other nice thing is it also helps with pain management. We'll use that in other areas of the body to help manage pain. Another way would be to increase the serotonin in the gap by maybe blocking some of these reuptake factories. So then it can't pull as much serotonin out of that gap. And those are called selective serotonin reuptake inhibitors. So we're inhibiting this reuptake of serotonin.
That's an antidepressant, right?
That's one label you can put onto it.
Okay.
It can also be a anti-muscle pain medicine.
Okay.
In certain areas of the brain, if serotonin is low, you will have depression. Other areas, over here on the right side, you'll end up having anxiety. Other areas, maybe in the prefrontal cortex or whatever, or not that, but the motor cortex, you'll end up having muscle pain. And so that's why with this musculoskeletal or myofascial pain, you'll see depression and anxiety a lot with these patients. So
I've seen that as a result. I mean, as a symptom. I thought it was me because it's just a bummer.
sucks to be you.
It's
right?
depressing to get diagnosed and to not know much about it and to
Yeah.
try to figure it out on your own. You know?
But that's one of the underlying causes.
Right.
Or it's caused by one of the same underlying issues, which is low serotonin. So yeah, things like Prozac, Zoloft, and whatnot. Another thing you can do, there's these medications called anticonvulsants. And let's say you put a little device, a little sensor onto a nerve, and you're seeing this kind of an effect with that. Well, if this is the minimum amount of intensity you need going through that nerve to make a muscle twitch, you can see this person's having a seizure. But if you could take and increase that threshold, you could see that, okay, this may still be going on, but it's not enough to make the muscles contract anymore. And that's how certain anticonvulsants work. Well, if you were to look at this and say, well, if this is a nerve conducting pain signals and you use an anticonvulsant, well, maybe it would reduce the amount of pain. And in fact, we see that. So anticonvulsants, B-U-L-S-A.
I don't even know that I've ever heard of an anticonvulsant.
Have you heard of Lyrica?
Oh, I have, because the commercials.
Yeah.
But I also see all these side effects, so then I'm like,
Yeah. Well, everything has side effects.
Right.
Drinking water has side effects.
So the level of pain, look, he's getting in trouble.
I'm getting in trouble.
He's
This
getting
is
in trouble.
Marissa.
I know. I told him, I was like, I gotta let you go. He gives me way too much time. And then the other patients
I'm always
are...
late.
I know, but then the other patients are sitting waiting. So we'll speed
But
it
they
up.
know I will take as much time with them as they need. Then here's where we can deal with the pain directly. So trigger point injections can be a way of dealing with this kind of pain. And that's where this fits in. We know that we don't like to use narcotics to treat this because, well, narcotics screw up stage 4 sleep. That'll just make the problem worse. You can give something like tramadol every so often. I don't like to do that. It is a narcotic, but it has unique characteristic to it in that if you take too much, it actually inhibits its own action.
And something newer, which I've prescribed me and I'm on, is LDN. And maybe next time I'm here, you could speak on LDN. Like
Low dose naltrexone is amazing.
Yeah, so,
strong
and surprisingly
anti-inflammatory.
safe,
Very.
right? Like very little to none
Yep.
as far as side effects.
The only real big side effects are crazy dreams when you're first starting it.
Oh, okay.
I'd say most people don't have that. And we can talk about that later.
Okay. But LDN therapy is another
Yep,
one, right? With
LDN.
pain and inflammation.
You bet. And then finally, things like behavioral therapy, physical therapy. Another big thing with this is if you're not getting the stage 4 sleep, okay, again, just like we said, you're not going to get the serotonin. So let's say you have sleep apnea. So a sleep study may be a really important thing to look at once you've maybe gone through some of these. And the really important thing to keep in mind is that not one of us is the same with our neurochemistry. And so what I'm saying is that you kind of have to monkey around with things to find out what works for you.
Much like our entire disease.
Yeah, so for instance, there are studies that show that if you start an antidepressant on somebody, only 4 out of 10 times will you get it right the first time. With antidepressants, it can take 6 weeks between just dose changes. By the third time you've changed antidepressants, you might get it 80% of the time. So it just goes to show that neurochemistry is really important. I was in Mexico. I wasn't sleeping, so I went to the pharmacia and got some amitriptyline. And I lost 2 days of my trip because I'm so sensitive to amitriptyline. I didn't know it at the time. So
It like knocked you out?
yeah, well, I just was a zombie, you know. So you didn't have to go to Senior Frogs to have that experience. So yeah, it is a very customized thing, but we monkey with it. What works for one person is not necessarily what's going to work for someone else.
Well, awesome. Thank you so much for this information.
So,
He's going to be a guest star. I just know it.